Hello, everybody. Thank you for joining me. So my name is Gregor Zorn. I'm actually come from you live from Slovenia. I'm going to be presenting the latest research in a therapeutic application of CBD and medical cannabis. There's a lot of material, so let's get started. So when talking about medical cannabis use, what are the symptoms or the medical conditions where actually patients are using medical cannabis for? So a lot of surveys deliver this information, and we can get a lot of insights of what people or patients are actually using medical cannabis for. So we can see here from this study from 2016 from the United States, the main conditions reported that people or patients were using medical cannabis products for were pain, anxiety, depression, headache and migraines, nausea, muscle spasticity, arthritis, and so on and so. So another study, newer study, again from the United States, shows us a similar trend. Again, number one, pain. Then we have back problems, which again is pain-related, anxiety, depression, and bipolar disorder, headaches, migraines, sleep issues, PTSD, and so on. So a newer study from this time, Australia, again, we see a similar picture where pain is predominant and number one again. And then we have anxiety and sleep and depression, inflammation, aggression, and so on. What's also interesting from this graph that we see here is the patients actually reported how medical cannabis products help them. So if they helped them a little, or they felt much better or better, and we can see that much better was in blue and better was in red, and together they were about 75 to 80% of the patients actually reported that they had much better results or better results with medical cannabis, again, in pain, anxiety, sleep, depression, inflammation, headaches, muscle spasms, nausea. And again, we are seeing a trend here. So this study was done on CBD dominant or CBD rich medical cannabis products. And again, we see chronic pain, number one, arthritis, joint pain, anxiety, depression, again, sleep problems, so headaches, PTSD, nausea, and so on. So very similar, all of these studies show us this very similar trend of the conditions, medical conditions and symptoms where cannabis is actually useful and people are using it for. And another study, and this time was done on dispensary workers, again in the United States, where medical cannabis is, unlike in Europe, it is actually bought and acquired by the patients in dispensaries. And oftentimes these patients ask for advice, these dispensary workers, for, I have this and this symptom or this and this condition. What do you recommend I should use? So again, the recommendation, what people were asking for was chronic pain. Again, we see insomnia, so sleep issues, again, anxiety, PTSD, also cancer, arthritis, depressions, Crohn's disease, headaches, nausea, and so on. So there is a trend that we see here, and pain, or chronic pain specifically, is very much at number one or even number two. And there is a reason. Many studies have shown, and we know of the therapeutic effects in pain, or specifically THC, or delta-9 tetrahydrocannabinol, which is the major, let's say, active compound in cannabis that has been studied, mostly studied, until CBD came into, let's say, the foreground. And we know that THC's effects in analgesia, so in the reduction of pain, are based via its direct activation of the endocannabinoid system via the CB1 and the CB2 receptor, so cannabinoid receptor 1, cannabinoid receptor 2. But also it has other effects that are very interesting, such as the effects on the opioid receptors. So the receptors where actually the opioids work on the endogenous opioids or exogenous opioids, prescription drugs. And we see here from this drawing that, again, it's not only on the nerve cells that the cannabinoid and CB1, let's say, receptors are present, but they're also present on other cells of the immune system, such as macrophages. So we can see a CB2 receptor, and also other brain cells like the astrocytes also have these receptors. So it's not only about specifically inhibiting the signal of the neurons. And also the interesting fact is that THC has an effect and does have activity on these opioids, so on mu and D opioid receptors. And we also have an interesting effect of actually when THC is taken in combination, in adjunction to, let's say, opioids, we can see a synergistic effect where actually THC reduces the amount of opioid needed to have this analgesic effect. So we can see here that in this case, when it was looked at morphine use and THC, it reduced the actual dose of morphine needed to have the same effect by just 1/4 of the dose was needed. So quite a significant reduction. And the reason is also, besides its activity on the opioid receptors themselves, is also an interesting fact. So these receptors, they can be by themselves or single, let's say. They can also form couples. So they can form couples of the same receptor. So these are called homodimers, or they can form couples with different receptors. So we can see here from this drawing that they can form couples of the same opioid receptors or of different opioid receptors. What's interesting for us is also that they can form couples between an opioid receptor and a cannabinoid receptor. And the interesting thing is that activation of one, so let's say of CB1 by THC, actually has the effects on the other receptor, as we can see here. So again, a lot of these heterodimers, and if you look at here, we can see that CB1 receptor with the mu opioid receptor has a potentiating effect. So activating one actually has also an effect on the other. So this is something also that we have to take into account when researching the effects that actually THC has directly or indirectly on the opioid receptors. But of course, there is also the other most prevalent phytocannabinoid, which is CBD or cannabidiol, which has again shown quite a lot of different effects in the reduction of pain, especially talking about chronic pain. And different types of pain, of course, chronic pain, we talk about neuroinflammatory pain, about neuropathic pain, and so on. So CBD does have a very well-known anti-inflammatory effect, as does THC. And of course, chronic inflammation oftentimes causes chronic pain. So by reducing, of course, the chronic inflammation, you can reduce the chronic pain. And this is where I think a CBD shines by the reduction and its potent anti-inflammatory effects. It also, again, is a multi-target compound. So it doesn't affect only one target in the body, but it affects a lot of targets in the body. Over 60 targets have been identified, of course. And it is actually has an indirect effect on the endocannabinoid system, on the CB1 and the CB2 receptors, but it has a lot of effects on other receptors, ion channels, enzymes, and other molecules, as we can see here, such as the TRPV1 receptor, which is also important in pain signaling. Also, it has indirect effects on some of the components, let's say, of the endocannabinoid system. But also, again, it does have effects also on the mu and delta opioid receptors. So that's very interesting. And these this was allosteric modulation, so not direct effects, but it modulates the effects of other compounds that have, let's say, direct effects. But these studies were done with very high, let's say, concentrations of CBD, which brings, the issue of, are these concentrations actually achieved in vivo, so in our bodies? And we can see here from this graph that both CBD and THC have effects on these two opioid receptors. And again, we have to take into account also the heterodimers. So when these two effects combine, especially with THC, but also CBD, we know has certain effects, such as allosteric modulation of the CB1 receptor, so being a negative allosteric modulator, as well as having effects also on the CB2 receptor. Now, regarding pain, this was published in 2017, and it was an overview of all the clinical trials of medical cannabis products and medical cannabis published in the United States. And they found actually conclusive or substantial evidence for the treatment of chronic pain in adults. So there is, besides all this, of course, preclinical evidence, also clinical evidence that cannabinoids and medical cannabis products can be used and are effective in the treatment of chronic pain. And what's interesting talking about cannabinoids and opioids is that opioids were never meant to be actually used for the treatment of chronic pain. We know very well that they have some, let's say, mechanisms of action that are not really suitable for a longer lasting period of time of treatment, especially in chronic pain, where we know that there are issues, of course, also with side effects. So a few studies, and these were quite big so-called space randomized clinical trials, where they analyzed opioids specifically in chronic back and hip pain and knee osteoarthritis pain. And they found that the treatment with opioids was not superior to the treatment with known opioid medications over a period of 12 months. So this did not support so-called initiation of opioid therapy. And a similar trial, this time with the very interesting title, I was a little surprised, found similar, let's say, results in this time chronic musculoskeletal pain. So there was no indicated advantage for opioid use over non-opioid medications. And we know the mechanisms of action of opioids are problematic, especially in tolerance, and how you need higher doses to achieve the same effects. So plus, of course, all of the other side effects that are mentioned with opioids. And what's interesting is that cannabis can here help. And in this study, which analyzed chronic opioid users who use it for specifically back or lower back pain, and they started also using medical cannabis. And what they found was that actually after starting medical cannabis, 50%, so half of them, were able to completely stop opioid usage, which took, of course, some time, because we know it is not easy to get off opioids. But cannabis did help, and it helped not only in the reduction or total cessation of actually opioid use, but it also, in those that didn't completely stop, it reduced the level of opioids that they were using. So when they were using medical cannabis along with the opioids, they could use, again, less opioids to have the same or similar effect. And this is very important, again. Medical cannabis being used for the substitution of opioid usage. And a bigger survey, this time with 525 patients who were already, again, on opioid prescription medications continuously for at least 3 months. And we're using it to treat chronic pain again. And they were using also medical cannabis in combination, so as an adjunctive treatment. again, we see very, very promising results. So 40% reported that they stopped all opioids completely. And this was also, again, very positive. 45% reported that they decreased the opioid units, so how much opioids they used. Again, we can see the synergy with medical cannabis and cannabinoids and opioid usage. And what's also important that this, let's say, change was sustained, and 65% of them sustained this opioid change for over 1 year. So it didn't just last for a short period of time, but it was actually sustained. And nearly half of them reported a 40 to 100% decrease in pain. And this is also very important. So the efficacy also of cannabinoids in reducing pain, not only in, of course, the substitution of opioids, but also in their efficacy. And one of the most important things that's oftentimes overlooked is that the quality of life. So 87% of the patients reported improvements in quality of life. And this is very important. Again, while cannabinoids and medical cannabis may not reduce completely, let's say, the pain levels, but it does reduce them to a level where they are manageable and when they allow these people to have a normal life, which is very, very important. Because if you have a medication that does reduce, of course, the levels of pain, but it makes you incapable of actually having a normal life, so you're being, like a zombie, it's problematic. And this is what is very important, of course, to these patients, is the quality of life, as we see here, and also the reported improvement ability to function. Again, having a normal life, being able to go to the grocery store, being able to go to work, being able to take the kids to school and so on. This is very important. And this is where, again, medical cannabis has quite an advantage. And also 62% of them did not want to take opioids in the future, which tells us again that they didn't have really good, let's say, experiences with opioids. And not only opiates, we also see medical cannabis being used for the substitution in other prescription drugs, such as benzodiazepines. Again, after using medical cannabis also with benzodiazepines, 30% of the patients reported that they actually reduced it after 2 months, and after 6 months, nearly half of them reduced. Again, we're seeing similar trends, completely discontinued benzodiazepine use. And we know also benzodiazepines are quite tough to wean off. So this is very encouraging. And also that medical cannabis and cannabinoids had these substitution effects, so they acted as well without the side effects as these prescription medications. And not only, again, with opioids and benzodiazepines, but we're seeing this trend in many other prescription medications. Here again, this is a study that was published in 2019, where we see in a number of patients that was over 1,000, that opioids were stopped using opioids, 72% of them. Benzodiazepines also, we see 70%. Also other prescription medications such as gabapentinoids, and also quite a high, let's say, level of reduction in SNRIs, so serotonin and norepinephrine selective inhibitors, such as, and also SSRIs. And the top reasons, again, were fewer side effects. So side effects are an important factor, of course, in patients let's say, determining which medication is better for them, and of course, better symptom management. So also the efficacy of these drugs has to be taken into account. Now, this was also something, again, that was talked about by Professor Nutt, and this was a study that we published this year. And again, we're seeing how important these two factors that I mentioned before are in evaluating the benefit versus safety balance in choosing the medication, this time in chronic neuropathic pain, so a specific type of pain where we found that, again, cannabinoids, especially balanced cannabinoid preparations with, let's say, quasi-equal or equal levels of THC and CBD seem to be better than others, especially because the main contribution was, again, quality of life and having more favorable side effect profiles. So this is very important in patients. Again, as I said, being able to function and not having all of these side effects is something why a lot of patients are actually choosing medical cannabis over prescription medications. And of course, they do have to work, otherwise, why would they substitute them? Now, what's also interesting that with medical cannabis, we are seeing patients who are using it, that there's also reduction in other, let's say, addictive substances such as alcohol. So this is also very interesting. And again, a study published last year where the majority of these patients were actually using medical cannabis for pain, insomnia, and mental health issues. Again, we see this type of trend. And 44% of these patients reported a decrease in alcohol usage frequency over 30 days, and 34, so one third of them decreased the number of standard drinks per week they have. So again, very important findings, seeing that, you know, with medical cannabis, it doesn't potentiate the use of other, let's say, addictive compounds, but it actually reduces them. Now, switching to anxiety, which we saw was also one of the symptoms or medical conditions that they actually noted as something that medical cannabis was used quite a lot. And we can see here that this was a large case series where they actually saw the effects of, this time only CBD, on anxiety and poor sleep. So the doses were mainly from 25 to 100 milligrams. There was one very high, and they saw quite really interesting effects. So with anxiety scores, they decreased in the first month for nearly 80% of these patients. And what's important, again, that they remain decreased during the whole duration of the study, which in this case was 3 months. Also, we see an improvement in sleep. So I think this is more an indirect effect of CBD. CBD by itself is not sedative, it's actually activating. But the issue is with sleep is what is causing, of course, this problem that people cannot sleep. So if people are having issues with anxiety or worrying too much at night or thinking too much, CBD can help calm them down. And I think it then actually causes this indirect effect on sleep, on being able to relax and sleep and so on. But it is effective, and we have shown these effects in many other studies. And talking about anxiety in general, this was also published last year when it was actually a systematic review and meta-analysis of all of these clinical trials for anxiety disorders. So looking at also PTSD, social anxiety, and general anxiety disorders. And just looking at this graph, we can see that most of, or nearly all of these studies actually did favor cannabinoids versus placebo. So cannabinoids were in general more effective than placebo, and it wasn't only about CBD. There were different preparations and of course different methods of use, but we can get a general idea that, you know, cannabinoids have quite a big potential in anxiety and anxiety related disorders. And this is also shown in preclinical studies. Especially here, we can see that how important or the role of the endocannabinoid system, and in this case, the CB1 receptor, has on actually anxiety and depressive behaviors. So in this study, they actually analyzed mice that were CB1 deficient, that didn't have this receptor. And they saw that actually, the loss of expression of this receptor produces an anxiety-like and depression-like behavior, which can be seen in how these mice actually react, and they groom and appetite and so on. So this again shows us the importance of the endocannabinoid system, especially in anxiety and other very important aspects, of course, of our and also animal behavior. And not only that, talking about cannabinoids and the brain, again, where anxiety often resides, right? We can see also the effects of cannabinoids on specific brain cells. And in this particular study, they actually showed how THC promotes the development and also myelination of the specific oligodendrocytes which are present in brain. So it promotes this maturation, and also it promotes this myelination, which is actually myelination, which is the layer that is found on not only on oligodendrocyte but also on neurons, which makes these which makes the signals of the neurons go faster, and it makes the functioning of the immune system the nervous system actually be more efficient. And this again makes us question and understand how let's say THC and CBD and other products can help in specific medical conditions where we see a degeneration of the specific myelin, in this case, let's say like in multiple sclerosis. And it makes us understand the process of why and how THC and THC-based products can help in these kinds of neurodegenerative diseases and also autoimmune diseases, of course. Another interesting study that was published this year, again, talking about brain and neurons, one of the things that is also prominent in especially in aging. So the more you age, the more we can see mutations in the proteins themselves. So these proteins that are very important, they do not fold correctly. So they have different non-correct structures, and they can have deleterious effects, of course, on the neurons, and can cause various conditions which can cause various, let's say, deleterious effects in the brain, and can cause aging, and can also be the cause of many medical conditions. And here, CBD, again, reversed these unnatural foldings of proteins. And again, if you remember, one example of proteins misfolding would be prions. So this was, if you remember, mad cow disease, which was actually due to these prions, which are just proteins that are not folded correctly. And when they start a chain reaction, which causes all of these deleterious effects. And also it can be found in humans, which was called Kuru disease or Creutzfeldt-Jakobson or prion disease. So again, here, a great potential specifically of CBD on these proteins, reversing these potential deleterious effects, plus, of course, all the other effects that CBD has, which are very important, such as reduction of oxidative stress and reduction, again, of inflammation or neuroinflammation. Now, one of the problems, again, staying still in the brain, is traumatic brain injury. So this is very prevalent, of course, in many aspects of life, such as, let's say, in injuries, in car accidents, in sports, especially where there is contact, of course, with the head. And this, again, preclinical study showed how THC when taken after injury or insult, actually had beneficial effects in the reduction of anxiety and depressive-like behaviors, in mitigating the injury deficits and short-term memory. So effects on memory, effects on anxiety-like effects, and also on prevention of actually injury. So this is very, very important, because these kinds of, let's say, concussions or traumatic brain injuries are very prevalent, and sometimes they're not even noticed. And these beneficial effects of THC, but not only of THC, could be very useful in the prevention of these kinds of injuries in the brain. And traumatic brain injuries, again, as I mentioned, they're very prevalent, and especially if you think about sports, especially contact sports, where you get a lot of headbutts in any shape or form, and whenever the head it has a traumatic effect. The problem is that the brain is encapsulated in liquid, and it just goes from one end to the other, and injury can occur. And in this study, they actually overviewed how cannabinoids, especially activating via the CB2 receptor, could be helpful in traumatic brain injury, TBI, via different effects. Again, reduction of new inflammation, or specifically neuroinflammation, reduction of neuronal loss, so preventing neuronal loss in specific areas like the hippocampus, which is very important, and the reduction or the transformation of these glia cells, so the immune system, from more, let's say, aggressive cells that can potentially also destroy or have deleterious effects on the brain cells, to beneficial states of this microglia. And also, of course, activation via the CB2 receptor doesn't cause, let's say, the intoxicating effects, because we know that CB1 activation causes these intoxicating effects. So also this is an important factor. And we know also that a lot of athletes, especially, let's say, in boxing and in MMA sports, are actually promoting the use of cannabinoids, and we are seeing people using CBD products right after they have a fight, because again of this beneficial effects that CBD and cannabinoids have in reducing inflammation. And we know the problem with the brain is that it's encapsulated in the skull, so it doesn't have a lot of space. So if inflammation occurs, if swelling occurs, it can cause a lot of problems. So reduction of this inflammation is essential to prevent any other problems that can be caused, of course, by these injuries. And we can see here another important thing or aspect that CBD has is that it actually increases the blood flow to, in this case, the hippocampus, again mentioned before, this important area of the brain, which is associated with memory and emotion, and is important, especially in memory processing, in let's say, in memory recall, and also in processing short-term memory into long-term memory. So by increasing the blood flow, we can, of course, increase the oxygen levels. And this is very important, especially if you think about any diseases or any injuries that might occur because you do not have enough oxygen in the brain. And this is very critical, and it's very fast, and it can happen, and we know it, that these injuries can be potentially very detrimental, and depending on the area where these injuries are, the effects can be various. And if we can prevent, of course, these effects of brain parts dying out because they don't have oxygen, by increasing oxygen, this is a very, very important and therapeutic aspect of CBD in this case, and cannabinoids, which should be applied. Now, talking about CBD, we very well know that it is used and has been promoted, and also we have prescription products such as Epidiolex, which are used specifically for CBD and epilepsy on the reduction of seizures. What's interesting is, of course, how does CBD work in the reduction of seizures? And again, being a let's say, target compound, it's difficult to pinpoint what actually does. Is it just one effect, or are there different effects? As we can see here from this drawing, again, CBD has effects on many different receptors and ion channels and so on. So it's difficult to pinpoint what exactly it does in helping reducing actually the release of these neurotransmitters that can trigger, again, these seizures. But not only CBD, also other cannabinoids such as CBDV, so cannabidivarin, which is the small brother of the propyl analog of CBD. So it only has 3 carbon atoms in the side chain instead of 5. And it has effects, again, via different mechanisms and receptors that could be helpful in specific types of epilepsy, especially in focal epilepsy. But not only CBDV, also THC, which is not often mentioned, but most studies did show that it had anti-epileptic effect and anti-seizure effects. But with THC, of course, there's always the issue of dosing and its biphasic effects, which are very well known. So dosing is very important, and with all cannabinoids, we know that, but it's specifically been shown that, let's say, THC can have, at a lower level, it can have, let's say, anti-epileptic effects, but at the higher levels, it has the opposite. And this has been shown also, it's typically for anxiety. So low levels of THC, they can have anxiolytic effects, while higher levels of THC can actually provoke anxiety. So, and again, you know, dosing is extremely important. And then, of course, there's the combination of THC and other cannabinoids and all these effects. And also THCV, again, here mentioned. So a lot of potential of cannabinoids actually that haven't been really researched on specific epilepsy. And we know that epilepsy, there are a lot of different types of epilepsy. So again, great potential in this area. Another area that's very interesting, of course, is cardiovascular health. And specifically for CBD, it is being investigated in this area, again, for its specific effects, you know, reduction in inflammation, antioxidant effects, anti-apoptotic, vascular protective, cardioprotective, neuroprotective. So it protects a lot of these cells and a lot of these tissues and organs, and also its anxiolytic effect. And the mechanisms of action, again, are very complicated in a sense. It has effects on different targets of course, these specific cells, such as the cardiomyocytes, so these cells of the heart, or also effects on inside the cells in the mitochondria, or the so-called engines of the cell that produce the energy. So these are very important, again, organelles, so to speak, of the cell, where CBD also can act, and also it acts on the tissues, as I mentioned, on the veins or the vascular vessels themselves. And it could be potentially used in quite a lot of different, as you can see here again from this drawing, different types of, potentially, of course, it has to be studied, different types of problems such as hypertension, heart disease, stroke, again mentioned, the effects of enhancing oxygen flow, neonatal hypoxia, diabetes, and so on and so on. So a lot of potential in this field. Of course, whenever we're talking about cannabinoids and cardiovascular system, there's always this notion that cannabis could, and especially THC, provoke some of these problems. So it's encouraging to see these studies, such as this one that was again published last year, where they did analyze a retrospective study where they analyzed, cannabinoid use and acute ischemic stroke, and they found that recent cannabis use was not associated with acute ischemic stroke. Of course, the problem with all of these studies is that what are they actually studied? Which population are they studying? So many of these populations are actually recreational users and not medical users. And we know that the difference in how recreational users or social users use cannabis is very different to how medical cannabis users use cannabis and cannabinoid products. So also, the target is different from them. For medical cannabis users, they have very specific targets to what to achieve, of course, symptoms, to really let's getting down the symptoms, and having a beneficial effect. Whereas with recreational use, it's a whole different game, right? So the problem is, and studies in the future will have to focus really on medical cannabis users, and also the different methods of administration are very important. And we will see, again, we'll have a better picture of how medical cannabis and medical cannabis consumption in medical users has an effect on all of these important factors in our health. Now, one of the studies, what was very interesting that was published this year was this study, a phase 1 randomized placebo-controlled study of nabiximols, which is Sativex, oral mucosal spray with temozolomide in a specific type of brain cancer, which is called glioblastoma multiforme. Now, I remember this study, and I actually saved this from 2017. It was actually the first, let's say, publications showing very good results from this study were actually published then, and only now the study has been published. And it's a very interesting study where they used Sativex along with temozolomide, which is the chemotherapy that is usually used in this type of cancer, compared to placebo, and analyze the safety, efficacy, and pharmacokinetics of these two products. And just to get an insight of what glioblastoma multiforme is, it's a very deadly, let's say, brain cancer. And it has a lot of people, but let's say a median overall survival is about 12 months or 14 to 16 months, depends. And the survival rate of over 2 years is from 8 to 12% of the patients actually survive. So a very high mortality, and it's a very, let's say, heart disease. And temozolomide, as I mentioned before, is in combination with radiotherapy, is what is usually used, and it does prolong, but only for a few months, so 2 to 3 months on average, the survival rate of these patients. So this is interesting. So they actually did this study by temozolomide, these patients being on temozolomide, and also adding Sativex, or nabiximols, as it is called in the United States. The doses were quite low, so 7.5 sprays on median, so on average per day. And if you think that one dose is about 2.5 milligrams of THC and CBD, it's about 20 milligrams of both. So 20 milligrams THC and 20 milligrams of CBD per day, which for cancer usually is not a high dose. But again, this treatment versus placebo, and the results were very interesting. So after 1 year, 83% of the patients taking Sativex were alive, versus only 44% of the patients on the placebo were alive. So and after 2 years, so the survival data showed that 50%, so half of the patients treated with Sativex were alive, versus only 22% of the patients treated with placebo. And again, also all of these scores, median survival time and so on, were better with Sativex compared, let's say, to placebo, where we also had deaths and so on. So it was interesting, and this information is also very important. So the follow-up of these patients, the ones who survived, show again a very interesting figure. So the estimated median overall survivor for the Sativex group was, let's say, 22 months, versus placebo, it was only 12 months. So nearly doubled the survival rate of these patients that were taking these doses of Sativex and temozolomide, and in conjunction. So that is quite a very interesting result, of course, with a limited number of patients, but it does prove something, that there is some interaction and some efficacy, and it should be studied more. And well, you know, this study wasn't publicized as it should have been, because maybe it was talking about cannabis, but any other drug that was not a cannabinoid, if they had these results, I think it would be all over the news. But with cannabinoids, we know there's always a problem. And this is something that has been showed also in other studies, again, with the same kind of brain cancer, so glioblastoma multiforme, a study or a case series from 2019, this time from Austria, where 9 patients with these brain tumors received pure CBD in addition to the, of course, treatment. And the doses here were higher. So it was from 200 milligrams to 400 milligrams of CBD, in this time pure CBD, per day, twice dose, so 100 or 200 milligrams per day. And the results, again, and here we can see in this drawing the effects, how complex the effects of cannabinoids are via the cannabinoid receptors. So you can see a lot of, let's say, downregulation and apoptosis and so on. And in this other drawing, we can see the effects of cannabinoids on non-THC cannabinoids on these different receptors. So besides, of course, the cannabinoid receptors, we have other ion channels and other GPR receptors. And if you look at the results that they actually saw, was that since diagnosis, 8 of the 9 patients who were on this type of therapy were still alive. And the mean survival time was 22 months. Again, remember, the mean survival time for these type of patients is around 12 to 14 months. So that was a great improvement. And also, one of them was alive for almost 4 years, another one for almost 3 years. They were still alive when they, of course, published this study. And there were also no signs in these patients, or some of these patients, in progression. So it also stopped the progression of the tumors in growth, and also no signs of new lesions. So there was also this effect, which is also very important. And another thing, again, mentioning is the patient's quality of life was also improved, because we have to, of course, know that chemotherapeutic drugs, they have side effects, and they can have an impact, of course, on the quality of life. So this is, again, shown in various studies that cannabinoids could help, especially in this type of cancer. And we must ask ourselves, if we had this disease, would we want cannabinoids as an option for treatment? If yes, then we should ask ourselves, what are we going to do, or how are we going to make these changes happen? Because right now it is not an option. Now, talking about, again, glioblastoma, also another cannabinoid that has shown in preclinical trials some interesting effects is CBG, or cannabigerol. Now, cannabigerol is very interesting because it has all of these effects. And again, in combination with CBD, it did show an enhancement in efficacy. Plus, it did show the additive effects in the reduction of cell viability and induction of cell death in these glioblastoma multiforme cells, which is, again, very interesting and should be studied in the future more. And CBG has shown also this potential in quite a lot of different cancer cells, let's say in colon cancer cells, in breast cancer cells, in prostate cancer cells, and so on. So it has this potential of being studied in different types of cancer. And CBG is a very interesting, let's say, cannabinoid, which is actually being also being sold in some, let's say, areas of the European Union as CBG products or CBG plus CBD products. It hasn't been available, so we don't know much about its efficacy in practice because people didn't have the ability of actually trying it out. And this is, again, is an important mechanism of feedback, how we get it, how we can start research in specific areas by people actually using it, seeing the beneficial effects and having this feedback. Then we can, implementing the knowledge that we have from preclinical trials with the knowledge that patients give us to actually do some real studies and show where it could be potential. It is actually non-intoxicating, so it's like CBD, but it does have an effect directly on CB1 and CB2 receptors. It's a weak partial agonist with a lower affinity to the CB1 receptor compared to the CB2 receptor, but it also has effects on different other targets, such as the PPR gamma receptor, nuclear receptor, which is actually in the cell. Also other receptors, as we can see, it is similar to CBD, a multi-target compound. And being a multi-target compound, it is also very interesting in quite a lot of effects that it has. And of course, potential, it has shown, again, analgesic, anti-cancer effects, anxiolytic, antidepressant, antibacterial, especially against antibiotic-resistant bacteria. And we can see it has a lot of potential, as we can see here from this graph, from neurological disorders, different types of diseases, and inflammatory bowel diseases, and so on. So a lot to be studied. And this is my last slide, just to finish off. What are the, let's say the future is for us for clinical studies, specifically for THC and CBD. And here is just to show you what studies they're recruiting for or enrolling by invitation right now. And we can see here for THC, we have to be careful because with THC, mental disorders and psychotic disorders, and of course, cannabis abuse, a lot of these studies are meant to show how THC is actually harmful and has deleterious effects on health. So, these studies maybe should be done on how THC can help in different medical conditions. But we also have, of course, pain, a lot of studies in pain, immune system diseases, genetic diseases, central nervous system diseases, brain diseases, and so on, metabolic diseases. So we can see, again, the same trend of these types of medical conditions. With CBD, on the other hand, when we talk about mental disorders, actually being studied how it could help with different mental disorders and psychotic disorders, of course, like anxiety and psychosis and so on, neurological manifestations. And again, we can see pain, even the reduction of cannabis abuse. Then we have, of course, different brain diseases, central nervous system diseases, skeletal or musculoskeletal diseases, anxiety disorders, chronic pain, and so on and so on. So quite interesting, let's say, studies that we'll see in the future. And we can see that over 100 for THC and just under 80 for CBD are being right now recruiting and enrolling. So interesting, let's say, information will be available to us in the future. I thank you very much for your attention. Let me see, we have a few questions. I don't know how the timing is, if we have time for these questions. So let me pause the share. Okay. So one question is any one area that cannabis will really succeed in? Chronic pain, epilepsy, mental health disorders. I think they have great potential in all of these areas. But what are you talking when we say about cannabinoids? There are over 177 cannabinoids, phytocannabinoids, have been isolated from the cannabis plant. And we only researched really 2. And so there's a lot of research to be done and a lot of potential to be done. I think the future will hold a lot of positive effects, especially in chronic pain. That's a no-brainer. The cannabinoids are being, and are used in pain quite successfully, as we have shown in many studies. With epilepsy, especially treatment-resistant epilepsy, it's also very promising. It doesn't work, of course, for every medical condition. It doesn't work for every patient, and so on, but it has a very good safety profile. So trying them out, the worst thing that can happen is that they don't work. So in my opinion, a lot of patients, would, if they had the possibility, they would try them out just to see if they work. If they don't work, they don't work. So, it's always an option. And in mental health disorders, it's also very interesting because it is contraintuitive, let's say, to think about medical cannabis being used in these kinds of mental disorders, but we're seeing great results with patients, let's say, especially in Parkinson's disease, Alzheimer's disease, all kinds of dementia, where they have great, effects in the reduction of these symptoms, and even the recovery of some of the things they couldn't do before, they can do with cannabis. But the problem is that the effects are only short lasting. So you have to take cannabinoids over, have let's say, a protocol of taking cannabinoids, but they do help. And again, especially in, these not only effects on the symptoms, but effects on quality of life. That again is very important for these patients. Okay, so this was a course question. So I'm part of the course that is at the University of Padua in Italy, which is its 4th year today. It's the only, I think, still the only postgraduate 1-year official university course on medical cannabis and all aspects of cannabis. It's our 4th year this year. It's also CME accredited, and it's a very interesting course. It is in Italian, so do keep this in mind. But it is a great, let's say, incentive for other universities to actually do this type of, let's say, program in other, let's say, areas of Europe. Now they dismissed my others. Okay, I think this is, what form of CBD do you feel is the most effective? There is no form that is most effective. It depends on what we're trying to do with CBD. Different forms have different beneficial effects in how fast they start acting and how long they act. Those are the main 2 things that you have to take into account. So inhalation of CBD via, let's say, a vaporizer of flower or a vape pen, the effects, you can feel them, and this is not only for CBD, it's cannabinoids in general. You can feel the effects very fast, right? Because you inhale the CBD, it gets you to your lungs, and from your lungs directly to your bloodstream, and you can feel the effects in a couple of minutes or seconds, depending. And so the effects come very fast, but they do last for a shorter period of time. Whereas if you take CBD products orally, then you need some time before they get digested, and they go through, of course, the stomach, and they get absorbed in the gut, and they get metabolized by the liver, and only then do they get into the bloodstream, and only then do they get to the area where you need them to work. So there is a delayed onset of action that you have to take into account, which is, it depends from half an hour to an hour and a half usually, and but the effects last longer. So again, these 2 types, let's say, of methods of application are not one or the other. You can use both of them depending on what you're trying to achieve. So if you're having pain now, or a symptom now that you want to decrease now, taking inhalation, is a better choice because it has an immediate effect. If you want that effect to last longer, then take the oral product, so it will have a longer lasting effect. So I hope I answered this. And also for topical use, usually the effects, so for creams, oils, and salves, the effects are very fast. You don't need much. In let's say the percentages used, very small percentages are used, and you can feel the effects, let's say, like with pain, inflammation, and irritation, itching, very fast. As soon as you apply, of course, if it's a problem of the skin, you can feel the effects immediately. If it's a deeper, kind of pain, let's say, that is deeper in the tissues, then you would need to massage it or take a systemic kind of products or oral product to have a systemic effect, because the deeper it is, cannabinoids really don't have penetrating capabilities by themselves into the skin. You need a special preparation like patches that enable cannabinoids to go through the skin and have a systemic absorption. So I hope I answered this question.